Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, some of the highlights. Today, more COVID-19 cases in Delta and Bayelsa states as government cautions against flouting the NCDC protocols. Resident doctors give update on the suspension of the nationwide strike action. And Brazil's coronavirus death toll reaches 50,000 mark, second highest after the US recorded in the world. While Africa continues to record more cases of COVID-19, with the continent now recording over 293,000 cases, Nigeria hit 20,244 with the announcement of 436 new infections in 18 states and the Federal Capital Territory last night. The Nigeria Center for Disease Control, NCDC, says 6,879 COVID-19 patients have recovered, and the death toll is put at 518. Of the 436 new cases, Lagos has 169, Oyo State 52, Plateau 31, Imo 29, Kaduna 28, Ogun 23, the FCT and Enugu 18 each, Bauchi 17, Bayelsa 14, Rivers 8, 6 each in Osun and Kano states, 5 each in Edo and Benue, Adamawa 3, Borno 2, and 1 each in Abia and Ekiti states. Let's take a look at the regional interpretation, seeing Lagos topping the southwest and the epicenter in Nigeria with 8,576 cases, followed by the FCT topping there in the north central with 1,567 cases. Kano leads in the northwest with 1,190 cases. Once again, Rivers State displaces Edo State in the south-south with the highest number of cases at 874 in that zone, while Borno tops in the northeast with 468 cases, Ebonyi in the southeast with 234 cases. Now, the governorship primary in Edo State of the All Progressives Congress APC members in the state have begun to choose their flag bearer ahead of the election in September. It's holding across 192 wards of the state, with 3 aspirants contesting for the governorship ticket of the party at the Ward 7 Oredo Party Secretariat in Benin City, the state capital. Party officials and delegates were seen conducting the exercise. Our correspondent monitoring the poll in the city reports that hand-washing items were provided while voters were seen wearing their face masks in line with the COVID-19 guidelines. The chairman of the party in the ward, Mr. Osamudiame Osayeko, said not more than 15 voters are allowed at a time at the polling center.
Total number of votes, Pastor Osege Izeyamu, 143 votes. Honorable Osaro Obaja, 20 votes. Dr. Pius Odubu, 14 votes.
Oredo was 7 is very, very peaceful. As you can see, today is our primary, and all the party loyalists, they are all here, ready for the primaries. And we've also maintained the PTF directives. When you get there, now you go and look at the container containing water and the washing soap and everything there. All our people are all putting on face masks, and we are maintaining social distance.
All about the COVID-19 protocols there. We'll bring you an update on that story as we get them. In the meantime, after a 6-day-long strike by the Nigeria Association of Resident Doctors, NARD, activities have returned to public hospitals and other tertiary health institutions affected by the industrial action. After a virtual meeting over the weekend, the doctors called off their strike effective today, Monday, 22nd of June, after calling national attention to the plight of resident doctors. The president of the association, Dr. Aliyu Sokomba, explained that the suspension was aimed at giving the federal and state governments time to fulfill the outstanding demands of the association. Joining us from Abuja studio is Dr. Julian Ojebo. He's the first Vice President of the Resident Doctors Association Nigeria NAD, and he joins us from Abuja. Welcome to the program.
Much, Millicent.
Dr. Ojebo, your association met and said that you were giving the government time to fulfill the demands. Why did you take this decision? How much time? Because we're looking at demands that have been there for quite a long time. Why did you decide to give the government time?
Thank you very much once again. The National Executive Council met on Saturday, and after deliberations, they all decided that following the interventions of the Honorable Speaker of the Federal House of Representatives, Right Honorable Femi Gbajabiamila, the Secretary to the Government of the Federation, Boss Mustafa, and so many other members in the House of Representatives, we did decided to sheath our swords on the interim. Now, we did that with the interests of Nigerians at heart, also looking at the rising rate of COVID-19 in our communities. We also did tell Nigerians that we are not strike mongers. We are not just after remunerations. We are after a better health care. We've been on the forefront crying and pleading that health should be moved from the concurrent list to the executive list, now to the exclusive list. If this is done, this recurring decimal of strike actions, we think, will be placed on hold. Now, you listen to the Secretary to the Government of the Federation when he did say that he never knew how pitiable the health system has been over time. And if you also watch the body languages of our governors, they've not been putting so much effort into the tertiary health institutions. Now, COVID-19 all over the world, the management for COVID-19 is from primary to tertiary health institutions. Now, in Nigeria, we don't have primary nor secondary health institutions. All the burden is moved to the tertiary health institutions. Now, when the state governors do not invest in the state tertiary health institutions, we have this level of decadence. Now, I'll give you an example. There's this high surge of coronavirus in Lagos. Lagos State still sits as the epicenter of COVID-19. What is the remuneration that our members in those states get? Less than 70% of the 2019 commerce. Now, if all of these states like Lagos, Abia, Gombe State, if they don't invest heavily in health, we'll keep have this recurring decimal where we have to go on industrial actions from time to time. But we're hoping and praying that we've given heed to the plea by the Speaker, by the Secretary to the Government of the Federation, and we hope that in 4 weeks' time, we should be having some positive feedback from the federal and state governments.
Dr. Ojebo, is it a case of some of these states you've mentioned, state governments, that they don't want to, that they don't understand some of the healthcare challenges our systems are facing, or they actually can't afford it?
Over time, politicians and executive appointees of government have always resorted to seeking better health care abroad. But let me draw your attention to this fact that most of the Nigerians, most of the doctors that they see abroad are mostly Nigerians. Now, if they for once would invest heavily in the health system, as we have it in Nigeria today, I don't think we're having these problems. Now, most of the reasons why we have brain drain is owing to the poor welfare system in Nigeria. Now, after COVID-19, most of these foreign nations will be calling from poor resource country to come over and help their health sectors. Nigeria is still going to have another bout of brain drain. Actually, I target brain gone, because in no distant time, most of these doctors will be moving abroad to get better welfare packages for themselves and their families. Now, doctors in Nigeria don't even have enough security. The case in study in Gusawa, one of our doctors was butchered in cold blood. In Kaduna, one of the doctor's wife was murdered. Now, if this recurring decimal is seen, most doctors have no other option but to seek greener pastures abroad. So we are pleading to the governors of this state, Lagos State, Gombe State, Abia State. Abia State has its own salary arrears between 18 and 36 months. How do you want your doctors to be motivated to work? Now, there's no motivation to working. So we're pleading to these governors, please take care of your health system in your various states. Let there be improved welfare packages for our members. Now, when these are done, you see that the doctors will be motivated to work.
Some of the issues were also raised by your association, the Kaduna State situation, and also some of those that were told to leave work in Jos. Now, what have the state governments of those two states been saying?
At this very moment, the Kaduna State government has slashed salaries of our members by 25% for the month of for the last 2 months. And we've not gotten any positive feedback from the Kaduna State government. We're hoping that while the president of the association, Dr. Aliyu Sokumba, will be interfacing with the governors forum, where all the governors will be there, we're hoping that we'll have some positive feedback from the governor of Kaduna State. Now, for the disengaged members of the Jos University Teaching Hospital, all 26 doctors have been reinstated, and we're hoping that their salaries that were being owed in the period where they were illegally or illegitimately disengaged will be paid to them in no distant time.
Tell us about the release by the federal government, and this is the 4.5 million or so on the hazard and inducement allowances. Some people have also said that perhaps the resident doctors are under pressure, and this is why you suspended the strike. Because a lot of people are asking, with all the list of demands, have they actually been met?
The Nigerian Association of Resident Doctors is not under any pressure, as it were, to call off the totally definite strike we embarked on. The National Executive Council did see that we have made our demands known. We are not inhuman to the plight of Nigerians. And we are hoping that with the 4-week extension that we have given to them, in which we've suspended our indefinite action, we're hoping that these demands will be met and we can have positive outcome when we reconvene in July 2020. Now, the issues of the 4.4 billion that was released, according to the Minister of Labour and the Minister for Information, these monies were released to all members, all healthcare workers in the federal health institutions. So far, we have about 15 feedback from 15 of our federal tertiary health institutions that they've received these monies. We're hoping that before the day unwinds, we should be getting up to the 31 that they said they've paid. And we're also appealing to them to, in good faith that we showed to them, to also make sure that the other centers also do get their remunerations. We are hoping and praying that this will motivate the healthcare system and healthcare workers in the various federal tertiary health institutions to go back to work. We're also appealing to the state governors to also give some form of inducement allowance in the same template as the federal government, so that the members, our members in the state tertiary health institutions, will also be motivated to go to work and fight the COVID-19.
We'd like to thank you, Dr. Julian Ojebo, the first Vice President of the Resident Doctors Association of Nigeria now. Thank you for joining us.
Thank you very much.
We have more on the COVID-19 updates when we return. Stay with us. In Delta State, 2 top officials of the Delta State government are currently self-isolating and in stable condition. They were among the latest patients to test positive to the coronavirus disease. The Chief Press Secretary to the Governor, Mr. Olisa Ifajika, named the officials as the Secretary to the State Government and the Commissioner for Information. According to the Governor's spokesperson, both officials showed mild symptoms of the virus and consequently subjected themselves to the test. Residents of the state have once again been advised to strictly adhere to the COVID-19 protocols, as anyone, irrespective of status, could contract the virus. In Bayelsa State, they recorded 14 new cases of COVID-19, putting the total number of confirmed cases in the state to 169. There are 130 active cases, 29 persons have been discharged, and the state has experienced 10 deaths. The COVID-19 task force is appealing to residents of the state to adhere to the recommended public health advisories to reduce the transmission of COVID-19. Contact tracing of a little girl who tested positive for COVID-19 has begun. The 2-year-old girl tested positive for the virus in Ogun State after she was admitted into the facility on account of breathlessness. The management of the Federal Medical Center in the state capital, Bayelsa, says her relatives are being traced and tests would be carried out. In Borno State, tertiary institutions are seeking ways to create safer spaces for students in anticipation of school resumption. While the state government is making plans to establish COVID-19 testing centers for returning students, the University of Maiduguri has engaged in mass production of hand sanitizers and face masks for staff and students.
Polytechnics, colleges of education, state and federal universities, and about 13 tertiary institutions in Borno State have all been shut due to the coronavirus pandemic. With the gradual relaxation of the lockdown, students and lecturers are anticipating the reopening of schools, just as the Borno State government is already making arrangements for testing of returning students, physical spacing, and general sanitation.
What the university needs to do is only to enforce the limits per room among students, and that will help in enforcing the social distancing safety requirement. The other ones are for the university to provide hand sanitizers.
In the University of Maiduguri, a committee for COVID-19 intervention has been constituted to drive the institution's response to the pandemic. The committee has so far produced 7,000 face masks and a large volume of hand sanitizers and other required items. The plan is to continue mass production before school reopens.
The major challenge we face and we will continue to face is this social or physical distances because of the nature of our classrooms compared with the student populations. We are thinking of even having morning and afternoon classes so that the students will maintain social or physical distances among themselves.
They believe observing physical distancing protocol can be achieved in classrooms, but the bigger challenge lies within the hostels.
I think it will be very difficult to practice this social distance within the campus only. But I know if it is in class, students will cooperate because 90% of the students, they are from village. And most of our people, because of their thinking, they don't believe in this coronavirus.
In the hostel that we are staying, is 2 jam-packed students. One room, you can see up to maybe 5 to 6 students. So I'm too worried about it when the school resumes.
The state government is also expediting action to complete a new hostel facility at the Ramat Polytechnic with the capacity to ensure adequate spacing. But the ultimate goal is to keep everyone safe and stop the spread of the coronavirus.
Let's now go over to our correspondent Simon Emperor in Niger State. He brings us an update on compliance levels there.
Niger State currently has a total of 66 confirmed cases of COVID-19. 28 patients have recovered and have been discharged. 2 deaths have been recorded. In terms of compliance with the directive or measures put in place by the state government, we still have quite a lot of teething issues where in many public places people still don't adhere to the guidelines. For instance, on Friday, we were at the Mina Central Mosque and we saw people going into the mosque without wearing face masks and without washing their hands even before going inside, despite the fact that the leadership of the mosque had provided washing hand basins with water. Now, also in the area of social distancing, we hardly saw that on Friday. On Sunday, we were at some churches. Now, what we observed was that even though the there was water for people to wash their hands before going into the church. We still had cases of non-adherence to the wearing of face mask. People were seen sitting in the church without putting on face mask, and also there is still concern with regards to physical distancing. But the leadership of the church had said that they would continue to harp on people to ensure they comply with the directive. In the market, that's the Mina Kure Ultra Modern Market, we also went, and there is still a lot of challenge there too. People don't put on their face masks, and the crowd there is also an issue of concern because the issue of social distancing is completely overruled in the market. But the state government had also said it will deal decisively with anyone found defaulting or violating any of the protocol put in place by the state government. From the complex of the Niger State Secretariat, Emperor Simon for COVID-19 update.
Thank you, Simon. Now, Brazil is the world's #2 coronavirus hotspot after the United States, as it officially passed 50,000 coronavirus deaths. This is a blow for the country that's already struggling with more than 1 million cases, rising political instability, and a crippling economy. With the soaring numbers, experts say the true numbers are a lot higher because of a lack of widespread testing.
Brazil has become the second country after the U.S. to register more than 50,000 deaths from COVID-19. It comes amid growing political tension and just days after the country confirmed more than 1 million coronavirus infections. Following world number 19, Gregor Dimitrov's withdrawal from the Adria Tour tournament due to his positive COVID-19 test, a second player has now tested positive. Dimitrov, 29, pulled out of the tournament in Zadar, Croatia with sickness after losing to 23-year-old Borna Koric, who played again on Sunday. A team of researchers in Japan say they have developed a saliva test that can give a result in as little as 25 minutes. Medical firm Shionogi has said it's working with Japanese universities to develop the test and that it would even allow people to take the test from home.
According to the NCDC, a sudden loss of taste and smell with fever, headache, or running nose may be COVID-19. They're saying please do not ignore the symptoms. Call your state hotline immediately to arrange for a test. You can visit their website. It has regular updates on the COVID-19 regulations and guidelines. From the World Health Organization, you'll find the coronavirus disease situation with the latest global numbers by country of COVID-19 cases on a daily basis. The website has rolling updates on the pandemic, the strategies, and each moment it's updated. Our website, channelstv.com, has the latest news. All you need to do is log on, access news in health, politics, business, sports, the latest from Africa and across the world. channelstv.com. That's a COVID-19 update. Thank you for watching. I'm Millicent Walker. Bye for now.